Well, hello everyone. I am not here in the flesh, but I am here with you in spirit. I am most likely driving on my way to beautiful Lake George for the AERT Radiological Teachers of New York conference. But I hope to share some knowledge with you today about capturing the digital images in DR and CR. It is a challenging topic, and there are some significant things to remember, including new vocabulary and the names of phosphors. But really, a lot of it comes down to the process. Also, you should be having a member of our faculty, Professor Chapman, here to jot down any questions that you may have during this so that I can get back to you since I'm not live doing this. So let's just go ahead and get started capturing the digital image. So there's a lot to talk about when it comes to the differences between computed radiography CR and direct capture radiography or DR. Usually CR comes in the form of a photostimulable plate, a cassette that we've been using in our lab and you've seen in the majority of the hospitals now. They need to be processed in some type of plate reader like the one that you see on your right side. So we'll talk about the process of exactly what happens when that cassette goes in there. And that's going to be a little bit later on. And then we're going to compare that as well as the process for both of these, but we're going to compare that to direct capture digital radiography or DR, which works with a flat panel detector. These flat panel detectors can be built into the radiographic room inside of each bucky in the table or the upright. Sometimes they are connected to one bucky but can extend to the other via a long cord. And more recently, we'll talk about this later as new developments, there are mobile flat panel detectors being utilized in DR. And we'll talk about some of the ramifications of that later on. So right off the bat, there is an advantage to direct radiography or direct capture. One, it has a high compatibility with the picture archiving and communication systems that we know of as PACS, but I don't really see that as the greatest advantage, so perhaps it should be listed right at the top because there shouldn't be an issue with getting information from CR into PACS. However, there are increased department efficiencies because you no longer have a plate reader, right? Images show up directly on a monitor that generally in front of you, so it's very fast. The compatibility with PACS can be helpful in terms of getting your patient information from a work list that just kind of shows up on one of your monitors, allowing you to double click on the patient versus entering the data which you might have with a CR cassette. Probably the greatest advantage is the fact that the DQE or detector quantum efficiency is better, and we'll talk about that a little bit more, but essentially it means that overall resolution will be better. And as a disadvantage, as we mentioned in the last slide, if you have a flat panel detector that is, stuck within a bucky and immobile, it makes it more difficult to do things like cross-table laterals, such as a hip or maybe a cross-table knee or any work in a stretcher or a wheelchair. And that's where, newer portable flat panel detectors that are essentially wireless will overcome that disadvantage more and more so in the future. So what is a detector element? So you take your flat panel detector and kind of microscope down into it, you will find many, 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 so thousands and thousands of tiny little detector elements, commonly known as DELs. And they're really, really small, maybe about 100 microns. or close to a tenth of a millimeter. So remember, a millimeter is barely putting your thumb and index finger together. Now imagine something that is 1/10 of that. Okay, but the little tiny dells, and you see one giant magnified one here, and this also will allow you to see why flat panel detectors are in the thousands. I think the ones we have in the lab in the old room 4, which is now room 1, that DR room, I think the flat panel detectors alone were about $80,000 each. And the reason I'm saying that is because they have a lot of tiny little electronics built into each of those thousands of dells. You have what's known as a TFT, which is a thin film transistor, right? That's up at the top over here. We'll talk more about these as we go through the lecture. You have a storage capacitor, right? That is a bucket for electrical charges. But by far, the largest section of the dell is the detector surface. And this is responsible for where our actual molecular changes are occurring, and either X-rays are being turned into light or X-rays are being converted directly into electrical signals. And we'll get down to that and more into it further on in the lecture, right? The bigger this detector surface, the more capability of intensity of radiation that can be absorbed and not lost. Photons that fall on the TFT or the storage capacitor would not be counted, would not contribute to the image. So this Dell surface area is sometimes defined as the fill factor being how large it is. And you can see here that in this case, the fill factor for this Dexel, which is another way of saying Dell, another way of saying detector element, is approximately 80% of all the electronics that make up the Dell. And the surface of this is amorphous selenium. We'll see that term a little bit later on as well. So the Dells are part of what's known as an active matrix array, or AMA. And as mentioned, you have as part of this, the thin film transistor, right? And a word here is that these detector elements are not the same as the pixels, right? They are numerical, so the computer knows where they are and they're tagged in such a way, but they're known to be dimensionless points of the image. Of course, they are certainly going to be related to the image that you see. So there is a tie to the contrast or the brightness level that is going to be attributed overall to the pixels in your image. So what is happening here, and where does detective quantum efficiency or detector quantum efficiency DQE come in? So as we said, this Dexel detector element is responsible for either absorbing X-rays or light based on a previous conversion from X-ray to light. And we said that the Dell surface area, right, which we can describe statistically by its particular fill factor, will determine the overall efficiency of the system. As the fill factor increases, so if we went from 80 to 90%, we would have an increase in our DQE, right? The larger the capture area, the higher the efficiency. And that makes sense because for each percentage we would increase the fill factor, we would be able to quantify more and more photons. Theoretically, if we do that, have an increased fill factor, we could typically lower the dose a bit. So the percentage of the semiconductor detector surface area that is dedicated to capture, as we've been saying, is known as the fill factor. Again, a higher fill factor will give you better overall resolution. In particular, it will increase what is known as your signal to noise, which for the moment I want you to